So you're here because you think you might have tooth decay, and in this video we're going to cover what it is, common causes, symptoms, as well as how to treat it. So first of all, what is tooth decay? Well, tooth decay, also known as dental caries or cavities, is a process that leads to the destruction of the hard tissues of the teeth. Now, it occurs when the bacteria in your mouth produce acids that erode the enamel, which is the hard outer surface of your teeth. Over time, this acid can break down the enamel and dentin, leading to cavities and potentially more serious dental issues. In terms of causes, well, tooth decay is often caused by consuming too much sugary food and drink and not appropriately cleaning your teeth and gums. Now, if you suspect that you or your child has got tooth decay, it's really important to see a dentist as soon as possible. And whilst I realise this is not always easy, it's really important, and that's because early treatment can help prevent the condition from worsening and other complications from developing. Now, in terms of symptoms, initially tooth decay might not cause any symptoms. However, as it progresses, it can lead to issues such as a hole forming in the tooth, which is known as a dental cavity. Now, if you've got a cavity, you might experience toothache, sharp pain when eating or drinking hot, cold, or sweet things. And that's because the inner layers of the tooth become exposed, including the dentin and something called the pulp. Now, these inner layers contain nerve endings that are sensitive to temperature changes, which leads to the pain when you eat or drink something hot or cold. Now, you might also notice white, brown, or black spots on your tooth. In some cases, the tooth or the gum can become infected, leading to a painful buildup of pus. Now, this is known as a dental abscess, and I've made a separate video on this elsewhere on the channel. Now, as I mentioned at the beginning of this video, it's really important to try and see a dentist if you experience problems like toothache or sharp pain when you're eating or drinking, or if your gums are painful, swollen, or bleeding when you brush your teeth. Now, ideally, adults should see a dentist if they haven't had a checkup in 2 years, and children should have a checkup with a dentist every year. Now, I realise that this isn't always possible, affordable, and getting in to see a dentist can be challenging. However, I've included a link in the description box of this video on how to find an NHS dentist in the UK and what to do if you're still struggling to find one despite this. Now, the treatment for tooth decay depends on its severity. Early tooth decay can be treated with fluoride treatments such as mouthwash or varnish, which a dentist can prescribe. Now, if you've got a cavity, you'll likely need a filling. However, if the decay has reached the soft tissue known as the pulp in the middle of your tooth, then root canal treatment might be needed. Now, root canal treatment is a dental procedure used to remove the infected or damaged pulp and clean out the root canals. After cleaning, the canals are filled and sealed to prevent further infection as well as to save the tooth. Now, in some cases, if the cavity is severe, the affected tooth may need to be removed, which is known as dental extraction. Now, a really important thing is to try and prevent a dental infection from occurring in the first place. In terms of prevention, tooth decay occurs when bacteria creates a sticky layer called plaque over your teeth, which can damage the surface of your teeth over time. Now, this condition is common in children, so it's really important to ensure that they care for their teeth and gums from an early age. Now, there are several simple steps that you can take to keep yours and your children's teeth and gums healthy and prevent tooth decay. First of all, make sure to brush your teeth at least twice a day with a toothpaste, spitting after brushing rather than rinsing. Clean between your teeth every day using floss or interdental brushes. Use sugar-free medicines and try to have regular dental checkups as advised by your dentist. If possible, also try to use an electric toothbrush, and similarly avoid having too much sugary food and drink, and avoiding smoking is also really important.